Breast augmentation is a common procedure, maybe one of the most common procedures that we do, and it involves augmenting the breast, making the breast larger. There's a number of different ways to go about doing that. Most of the time that involves a breast implant, which can be either silicone or saline. We can also sometimes do a more modest breast augmentation with fat grafting in select patients, but usually it involves placing a breast implant either in front of or behind the pectoralis major muscle and making the breast look larger.
They both help volumize the breast, but they do it in a very different way. An implant can create a very predictable amount of volume, can create a very round shape to the breast. If someone wants to go up in several cup sizes, an implant is generally the best modality to do that. We also have fat grafting as an alternative to breast implants. Fat grafting is a little bit more subtle improvement in volume. So we can get generally half a cup size to about a cup size in volume. It takes the existing shape and just makes it a bit fuller versus an implant, which will create a much rounder shape. So depending on the look that the patient is going for, depending on how much volume they're looking for, and if they're okay with an implant or if they're not interested in an implant, we've got options to be able to help patients out.
Some patients want to look very natural. Some patients want to look more done. There's nothing wrong with that, and there's no right answer. It's important to know that we can make it look almost any way that you would like, as long as we're having an open, honest, upfront conversation about what your goals are. The best way to accomplish that is with the use of wish pictures. We have you upload wish pictures of breasts that you like the look of.
Photos that patients will find on the internet, from celebrities, from other plastic surgery sites, from our own site, where patients say, hey, I love this look. I love the way this patient's shape is. I love how she looks in clothes or in a bra.
And in that way, we can use your wish pictures during the surgery. We can use intra-op implant sizers, and we can really see how different implants look on your body.
We have sizers that we can use in the office to help show the patient this is what 200, 300 cc's of volume looks like, help give an idea what the shape can be.
For some people, large implants do not that much, so we need to go bigger. For some people, get a lot of augmentation out of a smaller implant. In this way, we ensure that you wake up with the look that you want, more than just the cc's that maybe a friend of yours or somebody you know had. The recovery process for breast augmentation can be a little bit challenging up front in terms of depending on the size of the implants that we wind up placing. A larger implant is going to cause some tension. It can be a little bit uncomfortable for a few weeks, but really people are up moving around the same day. The next day they're up out of bed doing things in their house. Most people will recommend take 1 to 2 weeks off of work depending on what they do. About a month later you're back to cardio, and personally, 6 to 8 weeks later, people are doing almost everything that they were doing beforehand.
If you're interested in getting more information about a breast augmentation consultation, feel free to reach out at the office or fill out the form below, and we can schedule a consultation.